Hello, my name is Dr. Mark Alberts, Professor of Neurology and Director of the Stroke Program at Northwestern University Medical School in Chicago. This is a web update about new studies related to the treatment and prevention of stroke. What I wanted to update you about is a meta-analysis published in the November issue of the journal Stroke. This was a study done by David Greer and his colleagues at Massachusetts General Hospital and other facilities. What it focused on was the effect of fever and temperature on outcomes in patients who had had a stroke or a traumatic brain injury. This is a vexing clinical question that we have to deal with on a daily patient when we take care of stroke patients in the hospital, particularly in the stroke unit or the NICU. What this meta-analysis did is that it looked at outcomes from almost 40 studies that examined patients with acute stroke or traumatic brain injury cared for throughout the world at different facilities. They looked at a variety of outcome measures ranging from mortality to disability to Glasgow Outcome Scale and length of stay. What they found is that even though there was some heterogeneity between and among these studies, universally fever or elevated temperature was associated with worse outcomes, no matter how they were defined, in these almost 40 meta-analyses that included over 14,000 patients. So my interpretation is that this, again, is fairly convincing data about the detrimental effects of fever in patients with a variety of different kinds of stroke, as well as traumatic brain injury. Now, like any study or meta-analysis, this has weaknesses in terms of how fever was defined, how it was treated, and the different outcome measures used in the different studies. Nonetheless, when you have a meta-analysis that includes almost 40 different studies and over 14,000 patients, I think that speaks to the power of the underlying data. What does this mean to me as a clinician? Well, it tells me that we should aggressively be treating patients who have a stroke or traumatic brain injury when they get a temperature. It also tells me, obviously, that we need to take aggressive steps to prevent fevers in these patients. Another aspect of all this is how we measure for the presence of temperatures. And I know that in many hospitals and many units, axillary temperatures are used, and we have found those to be grossly unreliable, particularly in a stroke or traumatic brain injury or NICU type of setting. So we insist that patients with a stroke have their temperatures measured either orally or rectally, so we can accurately determine whether they are febrile and then go ahead and treat them. Obviously, there are many treatments available to treat fever or induce hypothermia in such patients, and those are still under development and research. But I think the bottom line from this large meta-analysis is that fever is detrimental, no matter how you look at the detrimental outcomes or effects. And to me, it makes sense that we should be doing everything possible to aggressively treat elevated temperatures in our stroke patients. Thank you very much.